2 stickers. That's it. 2 stickers can save a life. Yep, you heard that right. Today we're talking about Elliot, the HeartHero AED, and I'm going to show you exactly how to use it, what to do after the shock, and what to do when the person starts showing signs of life. You don't need to be a medic. You don't need training. You just need 60 seconds of guts and these pads. Let's go. First things first, exposing the chest. Rip or cut the shirt if you can, but honestly, speed is everything. If lifting the shirt is faster than cutting it, lift it. The goal is to see skin, not win a fashion award. To start treatment mode, press the green power button or pull the red tab. Elliot will then direct you to open the pad pouch and separate the pads from the blue liner completely. If the blue liner is on, the electricity never fully reaches the skin. Think sticker on skin. It's simple. Now for pad placement, the only part people really overthink. You do not need to be perfect. The pads have diagrams on them to guide pad placement. One goes high on the upper right chest just under the collarbone. The other goes in the lower left side chest, about a hand's width below the armpit. General placement is what really matters. Electricity isn't picky, but it does need skin contact. And speed to shock is everything. If the shirt falls back over the pads after you place them, who cares? The pads are already on. Now what about a lumberjack level hairy chest? Meet our good old pal, Mr. Yeti. If the chest is so hairy the pads can't stick, shaving helps, if you have a razor nearby. But do not burn critical seconds searching for one. Slap the pads on, press firmly, and let Elliot check skin contact. If the device needs better skin contact, it'll tell you. And honestly, you'd be surprised how sticky our pads are. Once the pads are on, listen to Elliot. Don't touch the patient. Elliot is analyzing the heart rhythm and looking for a shockable rhythm like ventricular tachycardia or ventricular fibrillation.
Not touch the patient. Analyzing heart rhythm.
If it is shockable, Elliot counts down aloud before delivering the shock.
Charging. Stand clear. Do not touch the patient. Shocking in 3, 2, 1. Shock delivered.
When Elliot delivers the shock, the single most important action has already happened. Now it's time for the second most important action, CPR.
Ensure emergency services has been called. Start CPR now. Push down hard and fast on center of chest between nipples.
Elliot has a metronome to guide your speed. In the app, you can choose compression-only CPR or compression plus breaths. Follow your local guidelines, but start CPR right away. Don't wait. Push hard, push fast, and let Elliot guide you. Let's say a miracle happens and you start seeing signs of life. They're breathing normally, their arms move, you see real purposeful movement. Stop CPR immediately and just monitor them. Elliot might say, continue CPR, because that's what it's programmed to do. But if the patient is clearly awake, breathing normally, just ignore the CPR prompt and keep monitoring them. Do not remove the pads and do not turn off the AED just because they're waking up. The pads stay on until EMS arrives. Elliot will keep checking the rhythm. If no shock is needed, it will clearly say,
No shockable rhythm detected.
You don't need perfection, you need action. Honestly, if you own an Elliot, please go take a CPR class. Be even more ready. And that's it. You're officially more prepared than 99% of the population to save a life. All you need is 2 stickers, 1 device, and 1 chance. Let's be ready.